Hi all. So let's talk about John, who has type 2 diabetes for last 5 years, and you can always refer to my previous video to learn about his story as we get into the next series for his case. So after knowing how long someone has had diabetes for, you also want to look at the control, the complications, and there are a few lab tests which are very much recommended by even American Diabetes Association, which helps us as physicians and endocrinologists to assess things further. There is hemoglobin A1C, but remember the hemoglobin should be normal to rely on hemoglobin A1C. You are getting a complete metabolic panel. You want to look at the creatinine, the kidney functions, as well as the liver functions, AST, ALT specifically, because many of these individuals or this specific condition goes hand in hand with fatty liver disease quite commonly. Lipid panel or the cholesterol panel. So looking at the LDL, triglycerides are quite commonly elevated in these scenarios with type 2 diabetes, as well as low HDL. So this is also called as dyslipidemia. I also prefer to add on to the apoprotein B, which could be a talk for next time, but that would be an added value for individuals with high risk for heart disease. The next one is urine microalbumin. So many of the patients are not aware of this, but this is an important test, a spot urine, so a random urine collection where the lab will test for microalbumin, which is microscopic protein, which cannot be seen in the usual urine dipstick that you may get done at your doctor's office or at an urgent care, which helps us to assess if there is an already initial damage to the kidneys by leakage of this microscopic protein called microalbumin, so that we can work on it together, and there is a chance that it could be reversed in early onset or early stage. The other important tests are also including thyroid test in individuals to ensure that that's not abnormal, and in selected cases they may need a complete blood count, they may need iron count, vitamin D levels, vitamin B12 levels, and then other tests could be based on if they have several other symptoms or relevant diagnosis coming along. So purely first step would be this. You may think about C-peptide, but that is very individualized, and I may do it in patients who I'm trying to wean off insulin to check their pancreatic reserve. So that helps us reassure if it is elevated versus very low or undetectable where they cannot be weaned off insulin. So all these nuances, it's better that you get addressed with a specialist, with an endocrinologist, but here I'm just giving you more of a general discussion which could be utilized for optimizing your health as well as adding on to your knowledge.